With coronavirus cases surging nationwide, many of us have someone in our lives who is dealing with the after effects of COVID-19.
Yeah, because a lot of patients are recovering and fortunately leaving the hospital. But once a patient leaves the ICU or an extended period of bed rest, a lot of people need physical therapy to return to a fully normal life. Joining us this morning to talk about some of those treatments and options is Mike Teater with Physical Therapy and Balance Center in Camas. Good morning, Mike. Good to see you again.
Good morning. Thanks for having me. Good to see you too.
Absolutely. So this is an important topic, one that I don't think we've really talked about so much is, what happens after someone has COVID-19? What are some of the challenges we're seeing with patients after they've recovered from a more serious version of this illness?
Yeah, no, absolutely. I think, one of the things with COVID-19 is that it can affect people in so many different ways, whether, you got COVID-19 and ended up needing to be on a respirator, or you had symptoms but didn't need hospitalization. Your function afterwards or recovery after that can look a little bit different. Some people may have had symptoms but never had the test, or could have even just been that because of the social distancing and the isolation, just started getting deconditioned. And so, looking at identifying, where you're at after going through this and what you need to do to get, back to where you were before all of this started.
Yeah, and so how do your physical therapists, really determine how to treat the people who were affected by COVID-19?
Yeah, absolutely. I mean, if you're finding that, coming through this or coming out of this, where people coming in and having, a decline in their balance, more difficulty getting around, maybe it's just unsteadiness on their feet or more difficulty getting up out of a chair, getting out of breath easier or more easily. Basically what we're looking is identifying what their problem areas are, and then just taking them through a series of tests to figure out what things that they can do to get them back on track with where they need to be.
It's interesting. I don't know that I would have thought about physical therapy
Yeah.
after an illness like this. You normally think about it if you break a leg or if you have a fall, something like that. But I think this is going to be really important, especially for some of our older patients who are hit harder by this. So what does treatment actually look like for people if they come to you and say, okay, I think I do need physical therapy here to get back on my feet?
Yeah, well, once people came in, I mean, we would do some screening with them, see what's going on. Are you having pain? What activities are you having difficulty with, so we can understand that. A lot of people are feeling down after going through all of this, and so depression screening, is that something we need to get them back in to talk with their doctor about? But then, once we've identified, what areas we want to strengthen, what areas we need to improve flexibility, or do we need to improve endurance or balance? We want to make sure that we go about this in a safe manner and match the right exercises for that person based on, where they're at right now. And a lot of the times this comes with looking at assessing what is their rate of perceived exertion. And that helps us understand the right level of exercise to give them, and even monitoring vitals during the exercise to make sure they're not overdoing it.
Yeah. Well, and like what Emily was saying, I mean, I don't know that I would think necessarily of physical therapy if this is something that I had gone through. So how does someone know, when they maybe should come in for physical therapy?
Yeah, I think the biggest thing is, there's so many exercises out there to choose from, and you could get online and find exercise. You could just go off what your friend tells you of what you've done in the past. But if you're really looking for, I'm having difficulties with this, and I want to know the very best thing that I can do to overcome it. That's where physical therapists really get a lot of their training, and really, are experts in that area. Is just pairing, the most effective or best, most effective exercise or treatment technique for what your goals are.
Do you have, real quick here, because we're almost out of time, but just a couple ideas, maybe some exercises people could try at home to get started, see if they maybe need to give you a call?
Yeah, absolutely. I mean, I think the biggest thing, like especially if you've come out of COVID-19 and you're having difficulties breathing or shortness of breath, is working on an exercise like belly breathing. And you could look this up on YouTube, but it's mostly just using your diaphragm to breathe, and it helps to promote rib expansion and makes relaxation, improves circulation, makes breathing easier. But also just getting started with walking. And if if like a 10-minute walk is difficult, starting with doing a series of 5-minute walks and build up to 30 minutes a day.
All right, cool. Well, thank you so much for all that information, Mike. Definitely, I think probably something not a lot of people have thought of
Yeah.
in this pandemic. Now, if people are interested in physical therapy in the Portland area, of course, we'll have a link to FYZICAL's website on coin.com. Thanks for joining us.